So I'd like to introduce Dr. Ellie Zhou. Is that how we say it correct? Just
Yes,
want to
you got
make
it.
sure. Perfect. She's an experienced board certified ophthalmologist who provides specialized care for a wide range of retinal conditions in adults and children. Um, she offers advanced medical and surgical treatments tailored to meet her patients' needs and is dedicated to clear communication and thoughtful explanations about conditions and treatment plans, making sure her patients feel informed and supported through their healthcare journey. So she's got a wonderful presentation, and I'm going to hand it on off to her.
Thank you so much. I'm gonna just share my slides here. I'm really excited to be here to give this talk. All right. So my talk today is on understanding age-related macular degeneration. And please feel free to ask any questions as we move along. I have a lot of slides, so I really wanted to give a really comprehensive overview of what macular degeneration is. So this is kind of the format of my talk. We'll start by reviewing what macular degeneration is, how the eye works, and then talk about symptoms, risk factors, treatments, and what's coming in the future. My goal is for you to leave feeling informed and empowered. Um, and so what is age-related macular degeneration, or AMD? So the macula is a part of the vision that's a central part of your vision, the sharpest area of your vision, responsible for seeing fine details, reading, recognizing faces, driving. And macular degeneration causes damage to that part of the eye over time. And it's the most common cause of vision loss in adults, especially over age 50. It doesn't take away all of the vision, but it can interfere with everyday activities, like reading, recognizing faces, driving, etc., which is why awareness is really important. So just some statistics about AMD. About 1 in 10 Americans ages 50 and older have the early form of AMD, we call the dry macular degeneration, and about 1 out of every 100 Americans age 50 or older have the more advanced form that could be vision threatening. And it affects millions of people in the US and worldwide. And as the population ages, we expect the number of people affected to grow over time. So you can see 11 million cases in 2020 in the US, projected to be 22 million in 2050, and about 196 million worldwide. So before we talk about macular degeneration itself, it's helpful to briefly review how the eye and the retina normally work. I'll try to keep this simple. You don't really need to remember all of the names, just kind of the concepts and maybe some of the main things that play a role in macular degeneration. So light enters the eye. Um, Sorry, I'm gonna get my pointer here. Um, and then it's focused on the retina, and in the area of the macula, that's where the finest vision is. This is, responsible for a lot of our reading and central vision. And this is kind of a zoomed in view of the cells in the area of the macula. So if we kind of flip this around, this little dip here is the very center of the vision, and then the sclera is the back wall of the eye. And we'll mainly focus on the area of the retina that's in the red box here. Once you understand these layers, it becomes much easier to understand what goes wrong in macular degeneration. So this is kind of a 3D view of the area I just boxed. The retina is made up of multiple layers of tissue that work together to give us clear vision. I'm going to walk through each of these layers and why it's important in AMD. So we'll go through them one at a time, just to give you kind of a basic understanding of the parts of the retina that are most important in AMD. So the photoreceptors are the light sensing cells of the retina. These are very, very metabolically active cells, meaning they produce a lot of waste, and they really depend on the surrounding layers for oxygen, nutrients, waste removal. And if the surrounding cells fail, like in macular degeneration, these photoreceptors, the cells that really transform light into an image, they get damaged and our vision gets damaged. And then the RPE, or the retinal pigment epithelium, is this thin layer that's right underneath the photoreceptors. This layer really supports the photoreceptors. So remember that the photoreceptors are really, really active cells, so they make a lot of waste. And the RPE layer works to clean up that waste, and it helps also recycle vitamin A. So the photoreceptors use vitamin A to turn light into vision. So the RPE helps recycle that vitamin A so that the photoreceptors can keep working and keep translating that light into an image. And the RPE cells also help deliver nutrients to the photoreceptors and acts as a protective barrier, so it controls what gets in and out of the retina, shields the retina from harmful toxic substances and excess light. So in AMD, this RPE keeps the photoreceptors healthy, but in a moment I'll show you a picture that in AMD, the waste builds up under this thin layer of RPE, and this interferes with the function of the retina. And eventually, this layer of the retina gets stressed and can cause the light-sensing photoreceptor cells to stop working. And then another layer that's important in AMD is the choroid. This is a layer of big blood vessels under the RPE that bring oxygen, nutrients to the retina, and then it helps remove the waste that the RPE is recycling away from the retina. And so in AMD, with aging and other conditions, the blood flow, this choroid layer gets thinner and the blood flow decreases, and this leads to a little bit less efficient removal of waste material. And when that waste can't be really removed efficiently, then, abnormal material accumulates under the retina. And we call that drusen, which is first sign of AMD. I'll review that in just a little bit. So age-related macular degeneration is when abnormal deposits build up under the retina. So this is normal retina, the center of the vision, the macula. And in AMD, you have these abnormal yellow deposits that build up under this RPE layer, the support layer of the retina, called drusen, and that can sometimes lead to cell loss or abnormal vessel growth. And so I want to go over what causes age-related macular degeneration. There isn't really one single cause of AMD. We understand some of the major factors that contribute to it and why the retina becomes vulnerable over time. So a few things that contribute, to the development of AMD is a combination of your genes, age-related, just wear and tear, and then lifestyle and environment. So in terms of genetics, we know that, genes don't cause AMD alone, but they make the retina more vulnerable over time. So just because you have a certain gene that makes you more prone to AMD doesn't mean you'll definitely get it. So when you have a gene that makes you more prone to having AMD, the retina becomes less efficient at clearing that waste material, and it becomes more sensitive to inflammation, more vulnerable to oxidative damage and stress. So there are several genes. I won't really go over these in detail, but genes that are important in AMD include genes that are part of the complement system, which is a part of the immune system that helps kind of clean up our debris and fight infections and things like that. And this is kind of important in terms of, I'll talk about treatment in the future. The system, this part of our immune system that's overactive, that potentially contributes to AMD, is important in the pathway that we treat AMD. And then other genes that affect inflammation and how the eye removes debris is also really important in the cause of AMD in some patients. But again, having these genes alone don't cause macular degeneration. And then the second thing is aging related kind of wear and tear. And again, the macula works harder than almost any other tissue in the body. It's very, very active. We're constantly seeing light and processing light. So over time, waste products accumulate under the retina, and we talked about that. That's the drusen, these little yellow bumps that we see under the retina. And then over time, with age and blood flow problems, our system is just not as efficient as clearing this waste, and it builds up, collects as drusen, and the drusen can cause a little bit of chronic low-grade inflammation that can damage the support cells or the RPE cells. And then, so when those cells get damaged, the waste removal worsens, and then the photoreceptor cells that sense light, they kind of lose their support and they don't work as well. And then the third thing is lifestyle and environment. This is kind of what we think of as the trigger, and especially in people that are already genetically at risk for having AMD, this is something that might kind of tip you over the edge and may make things progress a little bit faster. So smoking, we know, is one of the strongest risk factors for AMD. So it increases oxidative stress, it damages blood vessels and can worsen inflammation. And those are all factors that can make AMD worse. And then vascular health, like things like high blood pressure, cholesterol, things that affect your overall health and blood flow. It can also reduce oxygen delivery to the retina and cause worsening damage. You can't remove the waste as efficiently if you don't have good blood flow. And then diet and nutrition. So diets, that are low in antioxidants, we know that oxidative stress can cause worsening AMD. So diets low in antioxidants can increase stress. So we'll talk about diet in a little bit, but green leafy vegetables, omega-3s, things like that can be protective. And these areas are important because these are areas where patients can really make a difference in terms of their AMD management. And we'll review that in a little bit. So just going over how AMD is diagnosed. So a lot of people with early AMD, when you just have the drusen, you might not have any symptoms at all. No distortion, no vision changes, everything seems sharp. So some people might be surprised to be diagnosed with AMD when they don't have any symptoms. So the eye exam is really important. The doctors will dilate your eyes, take a look at the back of the eye, look at the macula to see if they see these tiny little bumps in the macula. And then imaging that we get in the retina clinic, one of the most important things is called the OCT, or the optical coherence tomography. This is basically a picture like that takes a cross section through the macula so we can see all the layers of the retina. And we're looking for those tiny bumps in this back layer of the retina called drusen. That's the first sign of AMD. And other tests I will briefly touch upon is fluorescein angiography, sometimes in wet macular degeneration. You have leaky abnormal blood vessels. That this dye test kind of highlights all of the blood vessels in the eye, including the abnormal leaky blood vessels. And it can tell us if there's leaking or not. And then another thing we might get is called fundus autofluorescence. This is kind of a special image that tells us how healthy the support cells of the retina are, or the RPE cells. So this is normal, and then this is kind of the advanced AMD that has a lot of scarring. The bright areas are areas where the cells are under stress, these bright white areas. And then the dark areas are cells that we have lost. So this is really helpful in tracking the really kind of advanced type of AMD to see how fast that scar is growing. And then, so what are the different types of macular degeneration? So you have dry AMD, wet AMD. Those are kind of the most common terms that you hear. In terms of dry AMD, so, everybody starts out with dry AMD, the little drusen. Sometimes people may not be diagnosed with the dry form before they get diagnosed with the wet, because the wet form really causes the distortion, the vision loss. So people may not know until they get symptoms. But the first stage is the early dry stage AMD, and then you have intermediate stage AMD, and then the more advanced type where you start losing those cells. And then you have the wet AMD. I'll go over these a little bit in pictures, so it's a little easier to understand. So again, dry age-related macular degeneration, the defining characteristic are these drusen, these little yellow bumps when we look at the macula. So that's the first stage of macular degeneration. So when in early macular degeneration, you have small bumps under the retina. You don't have, we kind of, as retina specialists, measure the size of these bumps to know if it's early or intermediate stage. So early, you have smaller drusen. It might be a little hard to see on the exam. They're not very obvious, tiny, tiny, tiny little yellow bumps. And then intermediate dry age-related macular degeneration, you have a larger yellow bumps that are more obvious on exam. And then on the pictures, you can see these bumps are a lot bigger than an early AMD. And then the advanced stage of dry AMD, when the cells are so unhealthy that the support cells, the RPE cells, they start to get unhealthy and they die. And the light sensing cells, the photoreceptors above it, they stop working, which creates a permanent central blind spot in the vision. And this can progress over time, but it's important to know that not everyone with dry AMD will progress and develop geographic atrophy, which is this advanced stage of macular degeneration. Um, so, everybody is different and progression can vary very widely. But geographic atrophy is really the advanced stage where you have really missing spots in your vision. These black areas are just blind spots, and that can get bigger and bigger over time. And we'll talk about treatment for this in the later slides. And then you have wet macular degeneration, which is less common than dry AMD, but it tends to cause more rapid vision changes. So in wet AMD, damaged retinal tissue sends signals asking for more blood supply. They don't have good blood flow. They can't remove waste. So instead of healthy blood vessels, the eye makes these abnormal, fragile blood vessels that grow from underneath the retina. And these vessels, they can leak fluid, which is this black space you see under the retina in this picture. On exam, it's a little hard to tell there's much wrong, but when you get the picture, you can really see that pocket of fluid under the retina. And this is what causes the distortion of the retina and the distortion in your vision. And this distortion really kind of disrupts your vision and can cause dark spots in the center of your vision. So like this picture here, just everything in the middle is blurry. And these abnormal blood vessels that grow under the retina, they can also bleed. And again, these are leaky, fragile blood vessels, so they can bleed. And then when a bleed happens, you get this big dark spot in your vision that shows up all of a sudden in the center of the vision. And if we don't treat macular degeneration over time, it can heal with a scar. So if you have a big bleed, you don't do anything for it, or some people get a big bleed and it's not treated for a long time, then it can heal with a big scar in the macula that can lead to a blind spot in the center of the vision. But this is like a really advanced form of the wet macular degeneration. And so what are some of the symptoms that you may notice? Again, in really early stages, you might not notice any symptoms. And as it progresses, you may notice blurry distortion of the center of your vision. You may have difficulty reading or recognizing faces. Straight lines, instead of looking straight, they might appear wavy or distorted. You can have kind of dark missing spots in the vision in more advanced stages. And then AMD affects contrast. So when you look at black and white, it doesn't look as sharp. Or when you're trying to distinguish shades or colors, it's not as clear as an eye that's not affected by AMD. So you may need brighter light to read. You may have difficulty driving at night or difficulty with glare. So those are some of the symptoms that patients may experience. And this is kind of a representation of what some patients might experience in their vision. So the center of the vision gets blurred, or over time we have what's called scotomas, which are those missing patches, missing cells in your vision that causes little blind spots in your vision. And then metamorphopsia is when your vision gets distorted, things don't look quite straight anymore, things are wavy. So those are some of the more common symptoms to watch for. And a lot of patients want to know, how fast does macular degeneration progress? So again, everyone's really different. So dry AMD, the dry type with just a little bumps, a yellow bumps, a drusen, it can progress really slowly. And if patients get vision loss, it can happen over many, many years, sometimes 10 years or more. So it's really varies between patients. And again, not everyone with the dry form of AMD will develop severe vision loss. But with the wet type of AMD, the vision distortions, vision loss can come suddenly. And that's why it's important to detect it early, to treat it early, then you'll have better recovery of the vision. So is there anything you can do to prevent macular degeneration or at least slow it down? So, everyone in this room is aging and some of us have higher genetic risk factors, and we acknowledge that. But we want to focus on what we can control. So we can't control our genes, but having the genes don't, again, they don't mean that we'll definitely get AMD, but maybe the retina has a little bit less margin for error. And we also can't stop aging, but we can make it less damaging. So the important things that we can control are our lifestyle and our environment. So again, I talked about smoking earlier, but avoiding smoking or stopping smoking is really important in preventing the progression of AMD. This chart shows here that smokers are up to 4 times more likely than non-smokers to develop age-related macular degeneration. So there's smoking is known to impede the effects of antioxidants, reduces the macular pigment density, and everything can lead to damage to the retina and kind of push you over the edge and make you develop more advanced forms of AMD. And former smokers have only a slightly increased risk of developing AMD compared to those who have never smoked. So current smokers, if you stop smoking, you can lower your risk of developing AMD. And then nutrition is really important. So as retina specialists, we do talk to our patients about, green leafy vegetables, things like that. There are certain nutrients that protect the macula. So like green leafy vegetables have lutein and zeaxanthin, and this is kind of like you can think of it as like an internal sunglasses for the retina. The macula itself has this yellow pigment that's in it. And when you eat these green leafy vegetables, it kind of replenishes that pigment that helps protect the eye. So like kale, spinach, things like that. Omega-3 fatty acids found in fish, they also support retina cell health. Vitamin C, vitamin E can help protect cells from those oxidative damage. So eating a balanced heart health diet, while it won't cure macular degeneration, it can support the retina and kind of slow the progression of AMD over time. And so this is really important. And then the AREDS2 vitamins, a lot of patients that have been diagnosed with AMD, their retina specialists tell them to take the AREDS2 vitamin. This is based on a really large study that was done years ago that looked at different vitamins and zinc, and it showed that there was a 25% reduction in risk of developing the advanced form of AMD that causes vision loss over a 6.3-year follow-up in patients with the intermediate type of AMD or the advanced AMD in one eye. The goal is to protect the other eye from developing advanced AMD. So it's not for everybody. In patients that have very early AMD, small drusen, it's not been proven to help. But if you have intermediate or advanced AMD, something to talk to your doctor about whether it's worthwhile starting this medication to slow the progression to severe stages. And then AREDS study, there's an original AREDS formula, which you may still see on the market. And then there's the AREDS 2 formula, which is what we recommend today. The AREDS 2 supplement replaced the original AREDS formula. It basically removed beta carotene, which was shown to cause increased lung cancer risk in smokers, and it replaced it with lutein and zeaxanthin. And it provides the same benefit in helping prevent progression of macular degeneration, but less risk. So we recommend the AREDS 2 formulation these days for patients with the intermediate type or more advanced macular degeneration. And then this slide here highlights something that's also really important. Macular degeneration, again, isn't just an eye disease. So we talked about blood flow issues that could affect the health of the eye. So the macula really depends on healthy blood flow, healthy body. The retina is one of the really most metabolically active tissues that we have. It needs a constant supply of oxygen, nutrients that come in through really small blood vessels. So anything that affects blood flow, inflammation, metabolism can all affect the retina over time. That's why we talk about things like exercise, managing your blood pressure, cholesterol, smoking. And again, these don't cause macular degeneration. They don't really cure macular degeneration, but they really influence the environment that our retina lives in, and it can help keep our retina healthier over time. So again, physical activity improves circulation, reduces inflammation, controlling blood pressure, and cholesterol helps support the blood vessels. So All of that is important. And then we may be talking to you about, protecting your eyes from the sun, UV protection. Um, and again, sunglasses aren't really a treatment for AMD, but they protect the eyes from kind of this cumulative damage from UV light and can help, but there's no definite evidence that it prevents progression, but we still recommend it. It's an easy way to protect your eyes. So in short, what's good for your health, your heart, your blood vessels is usually good for your eyes too. So that's important. And then the next thing is you want to detect changes early. So besides having regular eye exams with your eye doctor, there are things you can do at home to catch changes early. So if you've been diagnosed with macular degeneration, a lot of times your doctor will give you this grid. It's called the Amsler grid. You check one eye at a time, cover one eye or the other. And then patients with macular degeneration that's already affecting their vision, they may notice wavy lines in their vision. Basically, we ask patients to monitor each eye at a time, make sure there are no changes in the grids. If you already have changes, you want to make sure those changes are stable. If you don't have changes and the lines look perfectly straight, you still want to monitor once in a while to make sure that you don't develop any waviness in either eye. The earlier we catch the wet type of macular degeneration, the earlier we treat, the better vision outcome. So this is some examples of like what things can show up on the Amsler grid. You might have a missing area, a blind spot, and then some of the lines might be wavy. If you're normally normal and you start noticing wavy lines, you should contact your doctor right away and have it checked. Don't wait. And there are actually things that are available on the market. It's not very, oh, some of these things aren't really widely available, but these are kind of home monitoring systems that are a little bit more advanced than just the grid that you use at home. So this tool here, it's called the 4C Home. It's a home vision monitoring test for people with macular degeneration. And you check it regularly at home, and it checks your central vision for very subtle distortions that can signal very early wet macular degeneration, often before you even really notice symptoms in your daily life. And then this sends a message over to the company, and then it alerts your doctor if it detects changes. I have had some patients using this, not very often though. A lot of people, Amsler grid works just fine, but if you're someone that really, wants to check your eyes frequently, this is an option. And then home OCT imaging. So that image of the retina that we take in the office, this is something that was FDA approved, I think not too long ago. It's also a machine that, that can take a picture of your eye, send the picture over to like an AI machine that checks for any changes. This isn't very widely available yet, but it's something that could be used in the future to help patients at home just monitor for changes. So especially like if you're not in a big city, it might be helpful to use these tools at home so that you know when you should be going to see your doctor if you can't go very often. And again, early detection is really important in preserving vision. So what are some of the treatment options for macular degeneration? So we talked about the dry AMD. That doesn't really have a cure, but we can slow it down by protecting eye with the various things I talked about earlier. And then the wet form of macular degeneration, when the abnormal vessel starts to grow under the retina, starts leaking or bleeding. This is one of the most treatable causes of severe vision loss that we have today, if caught early. So again, the treatment for the wet macular degeneration, the goal is to kind of stop these abnormal blood vessels from growing, stop them from leaking, and to help the abnormal blood go away or the abnormal leaky fluid go away. And these are through injections of medication in the eye. They're called anti-VEGF or anti-vascular endothelial growth factor. They block the signal that tells abnormal vessels to grow and leak. So the common medications are listed here. I won't go through all of them. There's a lot of different medications, and your doctor can go over which one's best for you, and sometimes unfortunately may be limited by insurance and things like that, but there's lots of options available if one doesn't work as well for you. Different medication can work better, but these are typically, again, monthly injections in the beginning, and then we tend to extend over time if the retina's If the leaky fluid goes away, the blood goes away, we'll extend it over time to see how you do with the extension. And then some of the other treatment options. So we're always looking for ways to kind of not have to get as frequent injections or treatments for macular degeneration. So one thing that was out on the market and just came back on the market is called the port delivery system, which is an implant. We have to surgically put it in the eye that slowly releases the medication, the anti-VEGF medication over time. And so this really it reduces how often you have to get the injection. But we have to basically this little tool sits in the eye and slowly releases medication into your eye, but you have to refill it every 6 months or so that the medication can be refilled and keep delivering the medication to your eye. And some patients like this because they don't have to get as frequent injections. And then lasers were used in the past, it's not really used today anymore for treatment. And then for advanced dry macular degeneration, which is what we call geographic atrophy, when those support cells or the RPE cells, they die and they leave this kind of missing spot in your vision. And those areas are non-functional. The photoreceptors don't work. The support cells are gone. So, we don't have healthy cells there. Until very recently, we didn't have any treatment that could slow this process. So it's a process that kind of this blind spot slowly grows over time. You can see at the picture below, you have a small blind spot to begin with, and then it slowly grows over time. Eventually, it might cover the entire center of your vision. So in 2023, we had these two new medications that were FDA approved to slow this process of that scar tissue growing over time. And this is pegcetacoplan and avacincaptad pegol or Syfovre and Izervay. And these work by calming down the immune system or the complement system that we talked about. The genes that cause overactive complement or immune system can put you at risk for AMD. This injection of medication calms that down, so reduces the inflammation, slows down the damage to the retina cells. And the goal is to slow the progression of this process. It doesn't really restore vision that's already lost, but this is something that was really exciting for us because in the past we had nothing we could do. We just, if you have geographic atrophy, we could just watch you and let you know your vision's getting worse, nothing we can do, but now we have something we can do. And then it's an injection similar to wet AMD injections. You get this injection every 1 to 2 months, and it's something that you usually continue. You have to continue kind of indefinitely, because this slows the process of that degeneration down. If you stop it, kind of is back on track and the inflammation recurs and the degeneration continues. So this is whether this is appropriate for your situation or it really depends on the patient. So even when vision loss occurs, there are many tools that can help maintain independence. So, how can people with AMD that have lost vision, that have low vision manage? There are lots of great low vision services that are available, like Chicago Lighthouse, things like that, that can help you figure out what tools you can use to maximize the vision that you have. So, those are some of the great things to look into. Just as examples, there are glasses. Yellow tint has been found to really help improve contrast in patients because, again, macular degeneration can cause decreased contrast. So the yellow tint helps improve that contrast. And then there are these special glasses called the e-scoop glasses that have prisms that help move the image away from the damaged part of the retina and moves it just slightly over to healthier parts of the macula to get some vision improvement. And so these glasses can be helpful for patients. And then magnifiers, a lot of patients like these. Again, contrast and lighting is really important. So magnifiers with bright lights and then magnifiers that help make things clearer for you can help with reading. There's lots of different types of magnifiers available. There's electronic magnifiers that you can just put your reading material underneath it. It magnifies everything. You can adjust the contrast. You can adjust the colors if you like black on white or white on black. things like that. There may be like computer CCTV type of magnifiers that might be able to even read things out loud for you. So these are really helpful for people that like to read and still want to maintain that independence. These tools can help. And then telescopic devices, these things kind of magnifies things so that you don't have to be as close to what you're looking at to be able to make it out. There are special t glasses designed for watching TV so you can sit farther away from the TV and still enjoy a nice, clear, vivid view of the TV. And then some of the more things, if you're, like these kind of more techie things, there are lots of devices out there. This one above here is kind of like an augmented reality system that you wear. And it kind of overlays an image to what you're seeing already, and it improves the contrast of the image that you're seeing. And it manipulates like the pixels of the image so that you can see it better. And it also can shift the image to a healthier part of your retina so you can make it out better. And then the picture below, I have had patient, not with macular degeneration, a younger patient with genetic eye condition use these tools. Basically, it's something that attaches to the side of your glasses, and it's kind of a voice activated tool that uses an intuitive artificial intelligence that can describe audibly what's in the room, what you're seeing. It can describe labels that you're reading. It can even help recognize faces and may respond to questions that you ask of it. So these are really, there's a lot of different tools out there that can help with low vision. And then there's other things. So larger text reading materials at your local library, they may have a section for just large print books that can be easier to read with magnifiers. Audiobooks, there's lots of different audiobook options from the library or for people with low vision that can help. And there's talking aids, so talking clocks, talking scales, talking microwaves, talking glucose meters that help diabetic patients read the glucose, thermometers, things like that. Um, Large, clocks that you can press that can read the time out to you. And again, optimizing lighting can help make things sharper. So low vision services are really incredibly important because they help patients with macular degeneration that have lost vision live really well with the vision that they have today. There's lots of different services. When I worked at the VA, they had an inpatient service where you can stay there for a week or two and they kind of teach you how to function with low vision, to help you use different tools. So lots of different things out there that can help people live really well with the vision that they have. But at the
Dr. Joe, could I
yeah,
ask a question?
yes.
Okay, actually, two questions. One is related to what you're just talking about, these high-tech materials. Are those prescribed by doctors? Are they available at, say, the Lighthouse for the Blind? Where would such high-tech glasses, tint ones, for instance, be available as far as you know?
Yeah, so they're typically prescribed by a low vision specialist. So usually the retina specialist, as retina specialists, we don't prescribe these, but we refer you to a low vision specialist. They may be optometrists that specialize in working with people with low vision. So sometimes the lighthouse or special low vision areas will have low vision stores and things like that they'll write the prescription for you, and you can also go to the store to purchase some of these devices.
Okay. And then my other question was that I recently read about an implant that is for dry macular degeneration. That's a tiny little implant that's put into the eye. I don't know if it's FDA approved. It's through Science Corporation. I don't know if you've heard of anything like
Yeah,
that.
absolutely. That's a great question. So it's not currently FDA approved in the US. I think they've done like some implants in a small number of patients, but they're still looks like they're working on FDA approval. I was just looking this up recently. It's not very common, so haven't personally seen that many patients with it, with this particular type of implant, but I think they're still working on getting that approved.
Okay, so that's a positive thing for the future then.
Yes, absolutely.
Yeah. Thank you. And
Yeah.
thank you for
Hi,
the
could I
presentation.
ask a question, please?
Yes.
I'm Tom Green. I'm 76 years, right, and only started paying attention to my eyesight 4 to 5 years ago, and started with dry macula both eyes. Last couple of weeks, I've gotten wet in my right eye. What are the possibilities of that? Is there any connection between both eyes that I would develop the wet eye, with the wet macula, I beg your pardon, in the other eye as a result of being in the right, or can it stay separate for, as long as I'm hanging around?
Yeah, that's a great question. So each eye is kind of its own thing. They act a little differently. There might be certain things in your macular degeneration that might put you at higher risk of developing the wet type, but just because you have wet in one eye doesn't mean you'll definitely develop it in the other eye. We have lots of patients it's only in one eye. So it really varies between patients. So monitoring that with the doctor will be helpful.
Okay, thank you very much.
Mhm. All right. So again, low vision services are helpful, but at the same time, our research is moving quickly and there's lots of exciting work focused on protecting or even restoring vision and changing what's possible in the future. So I want to kind of touch a little bit upon what's coming in the future in macular degeneration. This is a picture of the implant that you had asked about. This is an implant that kind of sends electrical signals to this device that you wear and helps you see. It's not like perfect vision, but it helps give a little bit more contrast to what you're seeing, that's in clinical trials. So many new treatments are currently being studied in clinical trials. If it's something that you're interested in, you may be able to ask your retina specialist about available clinical trials. There's so many new approaches to treatments, including gene therapy, which I had been involved in. So, for example, gene therapy is really exciting because you can do a one-time injection of a gene into your eye, and this gene gives the cells in the eye instructions to make its own medication over time. So you can put a gene that makes the anti-VEGF medication. So instead of having to inject it in your eye, you have a gene in your eye that constantly makes this medication for you to keep the wet AMD under control. And that's really exciting. And there's gene therapies for dry macular degeneration as well that's being studied in clinical trials. You have stem cell therapy that could be promising. There's, lots of barriers to stem cell therapy, but basically the goal is to replace those unhealthy cells that were lost due to disease. Hopefully one day that'll be possible, but right now it's kind of in early stages still. And then potential treatments that you may have heard of, treatments that decrease stress to the retina, like kind of like these red light therapy, not really FDA approved yet, but under studies. There are injections of different medications that help control inflammation in the body that can help improve the disease, and then different implants again for kind of the late stages of macular degeneration when you already have a large scar there. And unfortunately, we don't have technology to replace those cells, but you can potentially implant something that will help you see better. So lots of exciting new things in the future. That's very promising. And if there's one thing I really want you to take away today is that, the macular degeneration is very common. It's something that we can actively manage at this time. Early detection really matters. Healthy lifestyle choices matter. And treatments today and those coming in the future are better than they've ever been. So if you or a loved one have concerns about vision changes, don't ignore them. Get checked early, and that can really truly make a difference. And thank you very much. That's all for my presentation. I'll take any questions.
Well, if nobody, I just want to affirm the Lighthouse for the Blind Low Vision Clinic. It was extremely helpful. The doctors at the University of Chicago are very good in taking care of my husband's eyes, but the low vision folks kind of help you figure out how to live with your low vision. And that's a little different area. And so there are a lot of resources available if we know where to go and who to ask.
Absolutely. So, and sometimes that, when your doctor is treating patients and they might not think of referring you to Lighthouse, is something that you should ask about. Can I get a referral from patients even without severe vision loss? You can ask for a referral. If you have macular degeneration that's affecting your vision, there's lots of things that can help.
Dr. Joe, it looks like Dina raised her hand for a question. Dina, there you go. You're unmuted.
Hi, thank you. What I was really interested in was also possible marketplaces with some of the adaptive devices that you recommended. Um, are there, I know that you can potentially go to the doctor to get some things, but for example, the microwave, are there some recommendations in terms of viable marketplaces so that you're not being taken for a little ride financially in getting some of these adaptive devices? That's the first question that I had. So I'll let you answer that question first.
So as far as I know, I guess it's still a relatively small market. Where I've seen these sold are really some of the low vision places. So like Lighthouse and things like that. They will have their special store that sells these things. I don't really know of anywhere else that sells these things. I think the low vision specialist usually will probably know this a little bit better.
Okay, great. Thank you. And then the other question was availability of your information that you did from your slides. Is it possible for us to get the information in writing as well?
Yeah, so it sounds like it's going to be shared on YouTube and maybe a PDF link as well.
Okay, great. All right, thank you.
Yeah, Dr. Xiao, I wonder, a few weeks ago, I had a cataract removed from the right eye, which has dry macular, and it's been really a mess. At this point, they've said that removing the lens released the macular, and now it's sort of become more active. So that's challenging. Um, I'm also wondering about what other types of procedures or activities could trigger other negative impact on eyes. You know, that if you've been diagnosed with dry macular, what should you be extra cautious about?
Yeah, that's a great question. So, with macular degeneration, there isn't usually just one trigger. It's kind of a slow accumulation of damage over time. So, like the things that I talked about, diet and things like that will help. I don't know of anything that, will all of a sudden cause you to go from dry to wet. There have been some reports about having cataract surgery that could potentially accelerate age-related macular degeneration, but I'm not sure that there's been any large studies on that, and there's no definitive evidence that that actually happens. It might just be sometimes a coincidence when you have the cataract removed and things get worse. It's both of those are kind of aging related things, so they happen with time and with age. So it may or may not be related. It's hard to know for sure without kind of larger studies.
And so there's no other, you wouldn't caution us for like any kind of procedure around the eyes. We should double check and look at the other side, or
As far as I know, no. I would say for my patients that have cataracts, I wouldn't tell them not to get cataract surgery because they have macular degeneration. And a lot of procedures that you do around the eye, they don't really affect the macula itself. So most of the time it's okay, but I would discuss the specific situation with your doctor to just make sure that it's okay.
just to be aware. I was shocked.
You also have a question in the chat from Christine that says, what is the difference between Ambler Grid's black on white or white on black background?
There is no specific difference. So it's I know in our clinic we have the black and white, that's just what we have available, but all of them function the same. We're helping look for distortion and things like that. So both of them function similarly.
I just want to say that this was such a good and comprehensive presentation. And I'm really, grateful to have
Yes.
been here and for your time and work on this.
Thank you so much. I really appreciate that. Any other questions?
Well, I do think it's kind of amazing how little most of us who are pretty well educated know about our eyes. So I appreciated your kind of basic fundamental information about how the eye works in the different levels. So thank you.
Yeah, no problem. Hopefully it wasn't too much, but I thought it'd be helpful to help understand the disease and everything, but thank you.
My mother suffered from macular degeneration in both eyes, and by the time of her death, she thought of herself as being completely blind. I don't think she was, but she thought she was. And there was nothing that anybody could do for her at that time. But today, there's a great deal that you folks are doing for those of us with macular degeneration, and it gives us hope. Uh, and although the cells that are lost are now lost and will not be recovered, and you can't turn it around, but you can certainly slow it down, and I think that's a tremendous achievement. So I'm very grateful for the eye clinic and for you especially.
Thank you so much. Yeah, absolutely. There's a lot that's come out in the last 20 years, and there's a lot more to come. And hopefully one day we will be able to restore those lost cells, and that would be the goal, to restore vision eventually.
Wow.
All right. Thank you so much, everyone.
All right.
Yeah, thank you
Thank
very
Thank
much,
you.
Dr.
Thank
Zhou.
you. Great
Thank you,
presentation.
Renee.
Yeah,
Thanks for
thank you
sharing.
again.
All right. We really appreciate it. Thank you very much. And thanks, everybody. Yeah, we'll publish this on YouTube shortly. And yeah, if you wanted to revisit this, but big thanks to Dr. Zhou and the Share Network and all of you for joining. And thanks, Renee. And take care, everybody.
Bye-bye. Thank you.